Can walking really help protect your heart against having a heart attack? Cardiology nurse practitioner will be breaking it down for you in this video. But first, hello everyone, my name is Ray and I'm a nurse practitioner who specializes in cardiology, hospital-based medicine. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart and overall health and well-being. So if that sounds good to you, please do me a favor and do like my wife Barbara says, judo chop the subscribe button so you can become a part of this growing community interested in improving our health and lifespan. And make sure you turn on your notification bell so you'll never miss when I upload a new video. So if you've been following me along, I've been doing this walking challenge for the last 15, 16 days or so. I think today's the 16th, 16 days. And walking is probably the best form of exercise for those who are physically able to do it. Walking provides a broad health benefits across cardiovascular, metabolic, cognitive, and musculoskeletal domains, and can even reduce mortality, chronic disease incidence, and improve your quality of life. As far as mortality benefits, they're actually seen at pretty low step counts, around 2,600 to 2,800 steps a day, and it progressively increases with optimal benefits around 7,200 to 10,000 steps a day. So let's start with cardiovascular because after all, that's my favorite thing to talk about. Walking can reduce your systolic blood pressure, remember that's your top number, by 4 millimeters of mercury, and your diastolic pressure, the bottom number, by about 1.8 millimeters of mercury. I've had so many patients tell me over the years that they monitor their blood pressure in the morning and will go for a walk around the neighborhood, and when they come back and recheck it, their blood pressure is actually better. So the proof is definitely in the pudding. In case you don't know, hypertension is a major risk factor for having a heart attack or stroke. So anything that you can do to reduce your blood pressure is a good thing. So a meta-analysis of randomized controlled trials show that walking can decrease your waist circumference by 1.5 centimeters, body weight by 1.4 kilograms, and body fat percentage by 1.2%. This might not sound like a lot, but think about the damage that being chronically overweight or obese does to your body over the years and years. Walking can improve your cholesterol levels as well. Now, as a side note, although cholesterol alone is not the best predictor of coronary artery disease, high levels of LDL are associated with increased risk of myocardial infarctions or heart attacks. Walking improves insulin sensitivity and glucose utilization, and therefore reduces your risk of developing type 2 diabetes and helps with weight management, particularly when combined with reduced calorie intake. Both of those, obesity or being overweight, and type 2 diabetes, are also risk factors for coronary artery disease. Walking is also associated with lower risk of multiple cancers, including bladder, breast, colon, endometrium, esophagus, kidney, lung, and stomach cancers. When it comes to cancer prevention, both total step volume and step intensity or cadence are independently associated with reduced cancer incidence. This is incredible news, y'all. You've likely heard that there are some cancers that are genetic, meaning if you have a parent or sibling or close relative with any of the above cancers, a lot of times you might be at an increased risk or because of the familial predisposition to develop that particular cancer. You probably also know just how little we know about a lot of cancers. And so being able to arm ourselves with this type of information is amazing news. Of course, avoiding certain things like smoking can also reduce your risk of cancer too, but that'll be another video. Walking also has cognitive and mental health benefits. Walking can reduce your risk of Alzheimer's dementia. Walking helps with anxiety and depression. Sertraline or Zoloft and escitalopram or Lexapro were two of the top 20 medications prescribed in 2025. Both are for mixed anxiety/depression. Walking also helps with sleep quality and overall quality of life. I'll be doing a whole other video about sleep and heart disease, but I want to hear from you. Do you think sleep has any effects on your heart health? Make sure you comment down below what you think. Regarding musculoskeletal health, walking improves bone health across all ages, but especially enhances physical function in older adults, which in turn reduces fall risk and fall-related injuries in older populations. In case you don't know, as we get older, our fall risk increases, and falls are actually the leading cause of injury-related morbidity and mortality among older adults in the US. A fall in someone over the age of 85 is associated with the highest mortality rate of any age group, reaching 330 deaths per 100,000 in 2023. The intensity of walking matters. A 2025 article in the American Journal of Preventive Medicine showed that fast walking for as little as 15 minutes a day is associated with a 20% reduction in all-cause mortality, compared to only 4% reduction with more than 3 hours of slow walking. So for those that are pressed for time, walking a bit faster may provide more benefits. So you're probably wondering, how much should you be walking? Well, the short answer is as much as you can. And if you've been following my channel, we recently started a 30-day 10-minute walking challenge where I'm trying to get everyone to get into a habit of starting their day with a 10-minute walk. But you could do 5 minutes in the morning, 5 minutes in the evening. I started this challenge intentionally at a lower starting point to encourage as many people to join. But here is a little secret. Starting next month in February, we will be increasing our numbers. We're going to double our time to 20 minutes a day. So more to come on that. As far as major official recommendations go, the American College of Sports Medicine recommends 30 minutes per day on at least 5 days per week. Walking at about 70% maximal heart rate develops cardiovascular fitness. You can achieve this several ways, but if you're on a treadmill, you can increase the speed anywhere between 3 and 4 miles per hour to increase the cadence, or if you happen to have a treadmill that you can raise the incline, you can go up a bit, go up a bit and then go slower, but then increase the incline. Now, as always, the adult geriatric nurse practitioner in me wants to remind you to go low and slow. Do not try to go all in or too much too soon. Remember, health is wealth, and we are in for the marathon, not a sprint. So we don't want to risk any injury and be sidelined for weeks or months. Work your way up nice and slow. So if you've made it this far, I want to thank you for spending your time with me. I know time is one of our most precious gifts we can give, and it is finite. So thanks for sharing yours with me today. If you have any questions about this or any video, feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. Remember, it's free to subscribe, so if you haven't subscribed yet, this is your sign. Also, please consider sharing this with the people you love in your life. By the way, please go check out my video about diabetes and how to manage diabetes, or share it with someone that you know that may have diabetes. I'll see you in the next video. God bless you.